Hi, in today's one more blip and CVS Viva, we'll take up some more important random topics. First, we'll start with the cardiac output. It is quantity of blood pumped out into aorta in each minute by the heart. Okay, this is roughly around 5 to 5.6 liters in males, and it may be around 500 ml less in females. So the most factor that is determining cardiac output is venous return, and venous return is defined as the quantity of blood flowing from the veins into the right atrium each minute. Then one more related point is cardiac index, which is normal value is 3.1 or 3 liters per minute per square meter of body surface area. Then examiner may ask you how to calculate body surface area also. Then you need to be prepared for that also. Then points related to the cardiac output. Under most normal and unstressful conditions, the cardiac output is controlled by venous rate. That must be the first factor determining cardiac output. Then, of course, heart is not the primary controller because various other factors in the body and metabolism will control the venous return and cardiac output. If you take up the Frank-Starling's mechanism of Frank-Starling's law, the force of contraction is directly proportional to the initial length of the muscle fiber with the physiological load. That will help uh, the venous return to be pumped out because the more is the venous return, more the stretch on the ventricular muscle, more the stroke volume in time by the force of contraction. So, then one more factor is SI nodal stretch. If the venous return is increased, SI node will be mechanically stretched. That may increase heart rate by 10 to 15%. That may add to the cardiac output. Then one more is Bain bridge reflex. The outcome of this reflex is tachycardia, which is usually caused by increase in venous return. Okay, vasomotor center is also involved in this reflex. I am not going into detail now. Then, what are the methods of measuring cardiac output? They can be classified into direct methods, which are invasive, so we don't follow in human beings by using flow meters and all. But we will take indirect methods in which we have fixed principle or fixed method. Then we have dye dilution technique and method, and finally thermodilution. But fixed principle is the most common method, which is explained in all the books. Then what is cardiac reserve? This is the point where we are discussing in cardiac cycle also. It is not end systolic volume. The cardiac reserve means the maximum percentage that cardiac output can be increased above the normal level. For example, normal level is 5 liters per minute. If you can increase to 5 more liters, that is 100% can be increased. In that case, 100% is the cardiac reserve. Normal human beings, uh, it can be around 300 to 400% is the reserve capacity is there. Whereas in athletes and trained individuals for years, it may be 500 to 600% is the cardiac reserve. In heart failure, of course, there is no reserve at all. Its heart is unable to pump the normal demands also. Then heart rate, the point in YY is tachycardia, bradycardia. In normal resting adults, it can be from 70 to 80 beats per minute, and full range you can take it from 60 to 100. Anything above 100 is known as tachycardia. Anything below 60 is known as bradycardia. And we need to say some examples for each case. For example, tachycardia physiological is exercise, pathological thyrotoxicosis, and so on. Bradycardia, decreased temperature, and any conduction defects, that is pathological condition. So you need to be ready with these points for rapid fire in Viva. So definition of blood pressure is routine that can be asked in theory Viva and practical discussion also. So the definition must be clear and bold. You need to say that it is a lateral pressure exerted by the moving column of blood on arterial walls. Okay, that must be clear without any confusion. The normal values, you can say 120 by 80 millimeters of mercury. The systolic range 100 to 140 millimeters of mercury. Diastolic 60 to 90 millimeters of mercury. Anything above that is hypertension. Below that is hypotension. Then examiner may ask the types of hypertension and all, and you need to be prepared for that also. And one more point is mean arterial blood pressure, which is can be calculated by adding one third of pulse pressure to the diastolic blood pressure, or you can say diastolic blood pressure plus one third of pulse pressure. Pulse pressure is the difference between systolic and diastolic. Then cardiac output, blood pressure is regulated by two mechanisms: nervous regulation and renal regulation. Nervous regulation, which is also known as short-term regulation, because it can be done in seconds. 5 to 10 seconds is sufficient to make it back to normal, which is important per minute to cut down the minute to minute variation or the postal variations. So vasopressor is the best example for nervous regulation. Whereas renal regulation, which is also known as long-term regulation, it will take some time, hours to days, to adjust the volume of the fluid inside, that is blood volume or fluid volume, by doing adjusting the pressure diuresis, pressure natriuresis, and by acting through renin-angiotensin system. That will take a bit time. Then related topic is circulatory shock. By definition, it is generalized inadequacy of the blood flow throughout the body to that extent that body tissues are damaged. That is the definition. Shock is a surprise given by the circulatory system to all the tissues. That is circulatory shock. Then if somebody can ask the types. You can name hypovolemic shock, which is due to decreased volume. A subcategory is hemorrhagic branch, hemorrhagic shock, that can be due to hemorrhage. Then other varieties include cardiogenic shock, neurogenic shock, anaphylactic shock, septic shock. You need to be ready with each definition also. Then the examiner may ask you the treatment possibilities or how do you manage the case. Like how do you manage treat a case of cardiac failure that was given in the clinical case in theory. Management you need to prepare a bit. So it can be managed by attending the cause. For example, if it is hypovolemic cause, hypovolemic shock, you can give volume. That is simple ORS or simple you can say IV saline. In case of hemorrhagic shock, you can give blood transfusion or plasma transfusion. Then one more physiological point is head-down position may help giving more blood supply to the brain. You can give sympathomimetic drugs to cause vasoconstriction and increase the blood pressure. And in case of anaphylactic shock, you can give glucocorticoids. So we'll take all the other points in the next video, all the other random topics of the series. At this point, we'll stop so that you can recollect and retrieve the points of the video so far covered.